TB pericarditis presents with typical features of TB, including fever, weight loss, and night sweats, along with typical features of a large pericardial effusion, including dyspnea, cough, and an enlarged heart on chest x-ray. So this would be the most common presentation. However, given the numerous clinical entities of TB pericarditis and how it could present, you may be encountering different presentations. Patients may present, for example, with acute pericarditis with or without effusion, which is commonly characterized by chest pain that is relieved by sitting forward and shortness of breath. Patients may present with symptoms of cardiac tamponade, including elevated jugular venous pressure, hypotension, and muffled heart sounds, as you remember Beck's triad. Or patients may present with symptoms of subacute constrictive pericarditis, including ascites, leg edema, elevated JVD, worsening dyspnea and weakness over a period of time. They may present with effusive constrictive pericarditis, where you'll see both signs of constriction, in other words, right heart failure, with ascites and severe leg edema, but also tamponade. But majority of patients will present specifically with signs of a large pericardial effusion. And one study from South Africa showed that this was the presenting complaint of about 80% of their patients who were later diagnosed with a pericardial effusion. I want to make one more point on this slide. Due to the fact that cardiac tamponade is not an uncommon complication of pericardial TB and is so life-threatening, I want you to be cognizant of specifically paying attention to both distant heart sounds and pericardial friction rub on your physical exam, really of every patient, but especially of patients who are presenting with worsening dyspnea. And in patient in whom you identify distant heart sounds or pericardial friction rub, to make sure to check a pulsus paradoxicus, as this patient may be approaching a life-threatening emergency which will require an immediate pericardiocentesis. And I want to make sure that you don't miss these patients. So in patients presenting with severe dyspnea, tachycardia or hypotension, and distant heart sounds, please remember to check a pulsus paradoxicus.